My today's topic is young MI or young heart attack. Medium of communication, I think we will keep it in Hindi and English for the benefit of many. And those who have questions, they are requested to type it down in the chat box so that we can take it at the end one by one. So, what is young heart attack? We know what is a heart attack. कि हार्ट पंप करके पूरे बॉडी को खून देता है, लेकिन हार्ट को भी काम करने के लिए खून चाहिए. वो उसे 3 आर्टरीज देती है, 2 ऑन द लेफ्ट, 1 ऑन द राइट. कोई भी कारण की वजह से अगर उस आर्टरी में खून गाढ़ा होता है या ब्लॉकेज होता है, तो हार्ट को खून नहीं मिलता है एंड रिजल्टेंट चेस्ट पेन, घबराहट, सांस फूलना, हार्ट के मसल को खून कम मिलना, हार्ट का मसल कमजोर होना, ये सब हम हार्ट डिजीज कहते हैं. नाउ व्हाट इज यंग हार्ट डिजीज? क्योंकि पहले ये माना जाता था कि हार्ट अटैक, लकवा होना, ये उम्र के साथ की बीमारी है एंड नॉर्मली मोर देन 50-55 years. So whenever a heart attack occurs with the age less than 45 or age less than 40-45, it is called as young MI. Now, why is it important? It is very important because along with the patient, the family is affected. It is more of a social disease. It is more of a psychological issue. It is more of a financial issue because the breadwinner of the family can become incapacitated, or the breadwinner of the family, God forbid, can even die. Also, to the nation at large. See, India is growing, India shining, make in India. So, India is growing, and this young population is the future of India. So, if someone in the age of 40-45 develops a debilitating disease and he is rendered incapacitated to participate in day-to-day activities or to participate in financial growth of the family, the society, and the nation at large, it is a blow to everyone. It is a blow to India, it is a blow to the society, and it is a major blow to the near and dear ones, the family of the individual. And therefore, young MI is important. स्टैटिस्टिकली अगर बात करें तो आज से 10 साल पहले यंग एमआई वुड बी लेस देन 2%. यानी अगर 100 हार्ट अटैक है, सो 2 या 3 वुड बी यंग. बट नाउ इट इज राइजिंग एंड इट इज राइजिंग ट्रिमेंडसली. द रीसेंट डेटा सजेस्ट दैट यंग एमआई इज अराउंड 10%. एंड फॉरबिड, अगर ये आने वाले 10-15 साल में 20-25% हो गए, देन इट इज गोइंग टू बी अ बिग प्रॉब्लम. So, how is it different? What are the risk factors? How is it different from the MIs that occur, heart attack? MI matlab heart attack. How is it different from the heart attacks that occur in the older population? And what are the causes? What are the risk factors? Recently अगर बात करें तो टेलीविजन के बिग बॉस के कंटेस्टेंट एंड हार्ट थ्रॉब सिद्धार्थ शुक्ला, he was a young guy, he was a healthy guy, he suffered a heart attack and he expired. So the magnitude is big, and it is high time that we start to understand what is young heart attack. It is important to control the risk factors leading to young heart attack. The common risk factors that are found in the younger population is smoking. Smoking is one of the leading risk factor which leads to young heart attack. Then substance abuse, especially cocaine. Cocaine abuse has been linked to young heart attacks. Family history. If the family tree, the grandfather, grandfather, granduncle, uncle, father, elder brother, these people have history of cholesterol, hypertension, diabetes, or even heart problem, we are likely to develop heart attack in the future, and our risk is much more compared to other normal person. Obesity, motapa is now gripping India. In the school there was a study and they found that 28% students were ओबेस, 28% बच्चे मोटे थे। तो यही मोटापा, बचपन का जो मोटापा है, वो आगे जाके हार्ट डिजीज का कारण बन सकता है। हाउ इज इट डिफरेंट सिम्टम वाइज? सिम्टम वाइज इट इज वेरी डिफिकल्ट डिफरेंट बिकॉज इसमें अंजाइना रेयरली होता है। मतलब उम्र वाले हार्ट अटैक में क्या होता है कि दो, पहले थोड़ा चलने पे सीना भारी होना, फिर सांस फूलना, फिर धीरे 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 बढ़ के, सो दीज आर ग्रेजुअली प्रोग्रेसिव। बट इन मेजोरिटी ऑफ द यंग पेशेंट इट इज फ्लैश। यानी हमने सुना कि कल शाम को तो साथ में थे, आज रात को क्या हो गया, सुबह में पता चला कि उनको अटैक आ गया। सो दीज आर फ्लैश इवेंट्स। इट हैपेंस लाइक अ, यू डोंट नो कि कल क्या होने वाला है, एंड इट जस्ट हैपेंस। So most of the young MIs, young heart attacks are flash, and therefore any chest pain should not be ignored because it could be heart attack. Majority of us when we are young we feel कि हार्ट अटैक हमें तो हो नहीं सकता, मैं तो यंग हूं, अगर मुझे सीना भारी हो रहा है तो मैं इनो ले लूंगा, मैं गैस की टेबलेट ले लूंगा। बट the American Society of Cardiology guideline is कि whenever you have a chest pain, within the first 10 minutes एक ईसीजी होना चाहिए। फिर भले वो ईसीजी नॉर्मल हो और आपको बोले कि आपको कुछ करने की जरूरत नहीं है, ये गैस ही था या मस्क्यूलर था, वेल गुड इनफ, बट डोंट इग्नोर, बिकॉज इफ यू इग्नोर इट एंड इट इंक्रीजेस यू विल एंड अप इन ट्रबल। तो young MI is a reality. Don't try to hide from it. Don't try to, be कि ये मुझे नहीं हो सकता है। If we have a chest pain, better to diagnose. अगर normal निकलता है, good for everyone, right? Then comes treatment. Treatment is standard. Treatment is standard. Whatever treatment happens for heart attack in the elderly, the same treatment happens. It is important to chew an aspirin as early as possible. Nowadays, there is a movement wherein 325 milligram of dispersible dispirin, everyone advises to be kept either in their car or in their homes. So whenever you have a chest pain, you can, in a glass of half a glass of water, you can dissolve the dispirin and drink it, or even maybe chew it up. 325 milligram of dispirin or aspirin, it is not going to cause you any harm, even if it is gastritis or muscular pain. But if it is a heart attack, it will definitely help you. Then other medical therapy in the form of beta blockers, ACE inhibition, need for an angiography, need for an angioplasty, all would be decided by your family physician and your cardiologist. तो important ये है कि अगर diagnose होता है तो treatment would remain standard. There are also rare causes of young MI. One is atherosclerosis, कि भाई कोलेस्ट्रॉल का प्लाक जमा, खून गाढ़ा हुआ। But rarely there are two other rare causes like spontaneous coronary artery dissection, यानी आर्टरी में ब्लॉक नहीं है लेकिन आर्टरी फट गई, and that is also common in smokers. Stress, type A personality. So type A personality people who are stressed about everything, who are stressed about रशिया ने यूक्रेन पे कर दिया तो अभी हमारा क्या होगा, ठीक है, but then certain things are not in our hands. So there are persons who are type A personality and they are at high risk. Peripartum यानी women जब डिलीवर होती है उसके आजू बाजू का जो पीरियड है इज कॉमन फॉर हैविंग हाइपरकोएबल स्टेट्स। विमेन हु टेक ओरल कॉन्ट्रासेप्टिव पिल्स यानी ओसी पिल्स, ओरल कॉन्ट्रासेप्टिव पिल्स आर प्रोकोएगुलेंट। वो प्रोकोएगुलेंट यानी क्या है, वो खून गाढ़ा कर सकती है। सो लॉन्ग टर्म रेगुलर यूजेज ऑफ ओसी पिल्स increases your risk. Then there are certain genetic disorders, coagulopathies, factor 5 entophospholipid A, देन फैक्टर प्रोटीन सी, प्रोटीन एस। तो ये क्या है, जनरलाइज थ्रोम्बोसिस। ओवरऑल खून गाढ़ा होने के जीन्स अपने ज्यादा है। अपने बॉडी में खून पतला रखने के और खून गाढ़ा रखने के दोनों जीन्स होते हैं, बट इन सम पेशेंट्स जेनेटिकली खून गाढ़ा होने के जीन्स जब ज्यादा हो जाते हैं तो दे कैन सफर arterial and venous thrombosis at an early age. They can suffer such kind of things. So young MI, young heart attack में other than the routine risk factors like smoking, alcohol, obesity, cholesterol, diabetes, hypertension, some non-routine risk factors So some non-routine diagnosis should also be kept in mind, like hypercoagulable states, substance abuse, especially cocaine, and spontaneous coronary artery dissections and myocardial bridges are also common. So for today's lecture, I think we will wind up with this. द आइडिया इज कि हाँ, यंग एम आई कॉमन है और वो बढ़ते जा रहा है. लास्ट 10 साल में वो 2 से 3% से लेके 10-11% तक अप हो गया है, एंड इट इज अलार्मिंगली इंक्रीजिंग. सो बेटर सेफ देन सॉरी. अ स्टिच इन टाइम saves 9, यानी प्रिवेंशन इज बेटर देन क्योर. We have to adopt healthy lifestyles. We have to adopt healthy diet. We have to avoid excessive smoking. We have to avoid substance abuse like cocaine. And at the age of 40, we should get our first routine health checkup done. So I would suggest everyone who is entering their 40th birthday, 40 and above, should get their baseline blood investigation and baseline radiological tests done, so that you are well aware of your health, you are well aware of your numbers. See, when you talk about numbers, everyone knows their numbers, कि मेरे बैंक अकाउंट में ये, मेरा पैन कार्ड ये, मेरा आधार कार्ड ये है. But your health numbers are equally important. What is your blood pressure? What is your cholesterol levels? What is your sugar levels? What is your weight and what is your BMI? Is your BMI high? What is your ejection fraction? What is your pumping fraction of the heart? So these numbers are also important. These numbers are very important, and it is high time that we give health our priority, and we all should know our numbers. If we keep a check on these numbers, the future is bright. Future of India is bright. I think with this, I think I'll open up the session for questions if anyone have any. Again, one more thing, sorry, before ending. A recent study has found that walking and brisk walking is as good as running in decreasing or the cardiovascular risk. And therefore, I would advocate 30 to 35 minutes of brisk walking to all my listeners. 30 to 35 minutes of brisk walking per day, and it would decrease your cardiovascular risk. Thank you. So there's a question that a young boy of 21 year is suffering from chest pain. Would you recommend ultrasound over ECG for a thorough result in understanding the issue? See, at the age of 21, the differential diagnosis, यानी क्या क्या हो सकता है causes of chest pain. It could be simple gastritis, it could be muscular pain. Yes, heart disease can be a possibility, but at the age of 21, it is a secondary, it is a later possibility. So the first test that would be advocated is a electrocardiogram, that is ECG. And then based on the clinical findings, based on the presence of heart sounds and murmurs, if your physician advocates the ultrasound, you may undergo ultrasound. Baki, a simple cardiogram should be enough for this boy. How would I know if I have heart problem or anxiety? See, these are two different things. Whenever you have complaints of chest pain, whenever you have complaints of exertional dyspnea, यानी चलने पे सांस फूलना, whenever you have severe constriction, पत्थर रखा है ऐसा feeling on the heart, see, these are some of the symptoms which can point towards cardiac disease, and you have to rule out by showing to your nearest physician, getting an electrocardiogram done. And after that, still these symptoms persist and your doctor is sure that all the investigations are normal, you can attribute it to anxiety. Exercise and healthy eating would suffice, or genetic factors play a role? Of course, as I said, genetic factors definitely play a role. So let us say if genetically I'm more prone to develop future cardiovascular events, and I am a regular exerciser and I have healthy food habits, it can definitely decrease the incidence of future cardiovascular events. And therefore, exercise and healthy eating habits are to be recommended to everyone, to each and everyone. could a possible reason to be the canned food that we are chewing on these days? Definitely, permanent foods, canned foods, they have preservatives, they have high salt content, and these are all attributing factors. You cannot blame them one on one. You cannot say that it is because of this. There are a lot of the coronary artery disease is multifactorial. It is multifactorial. It can be obesity, it can be smoking, it can be alcohol, and on top of it, yes, this preservative induced foods which are high in salt content can be one of the risk factors. And by going slow on them, cutting down their total intake would definitely help us. What causes high cholesterol in children and teenagers? See, cholesterol is a basic necessity. Cholesterol is there in a lot of what would I explain to you? Cholesterol is required by the body for a lot of functioning, but when it goes high, it starts getting deposited, and when it starts getting deposited in the arteries, it starts blockages. So cholesterol is there in everyone, in the children, in the teenagers, in the adults. Cholesterol is there in everyone. But when it is persistently high and it starts getting deposited, that is when the problem starts. Yes, there are certain familial cholesterol disorders like genetic hypertriglyceridemia, genetic cholesterol disorders, in wherein younger children, teenagers have high cholesterol levels. Are there symptoms or red flags that coaches and parents and others should look out for signal in a young patient? Definitely. See, if the young patient or young person has a strong family history of sudden cardiac deaths, then that patient or that person should undergo certain basic testing, because congenital channelopathies and long QT syndromes and Brugada syndrome, and they are known. And before playing contact sports, we have heard that in contact sport, physical, wherein high physical activities and contact is required, they there are certain incidents of sudden cardiac death. We have heard कि gym join किया और weightlifting में he does suffered something. So before going for heavy exercise, before putting the people in contact sports and under rigorous training, the coaches should look for family history of sudden cardiac death, family history of young cardiovascular problems, and if needed, investigate that boy or girl. So, what are the tests done to does diagnose a heart attack? So basically, if there is a chest pain, the first test that should be done is an electrocardiogram, that is an ECG, and a blood test by the name of either CKMB or troponin. So if the troponin or CKMB is elevated, it means that the chest pain is because of heart, it is heart attack. And the ECG would also show some changes. And after these two basic tests, the further test can be echocardiogram, angiography, and so on and so forth. Even nowadays, CT coronary angiography is also done. But the basic two first tests, which can be done anywhere in the smallest of the clinic, would be a electrocardiogram and blood test in the form of either CKMB or troponin. How does smoking affect the heart? Smoking affects the heart in a lot of ways. Smoking is a vasoconstrictor, so smoking increases the blood pressure. Smoking has nicotine and other substances like tar and a lot of other chemicals that can affect the heart. And smoking is atherogenic. It increases the coronary plaque burden. It increases the what do we say, the blockages in the heart, and therefore smoking is one of the major risk factors, especially in the younger patients. So I think with this the questions are done, and with this we'll sign off. See you next time. Thank you.